Hi, this is Dr. Kiran Shankar, Associate Consultant, Cardiothoracic and Vascular Surgery at Apollo Hospitals, Bangalore. On World Heart Day, let's learn about dyslipidemia and how to control the lipid levels, which can definitely go a long way in strengthening our heart and to improve the health of the vascular system in our body. As we all know, dyslipidemia is one of the main causes of heart disease, and it is an abnormal level of cholesterol or the fats in the blood that is too high or low. Basically, cholesterol is a type of fat found in the blood, and it is essential for the general good health. However, if the body does not need it too much, as this can build up in the blood vessels to form an atherosclerotic clot, and it can interrupt the blood flow in the arteries of our body. Basically, there are two main types of cholesterol. One is the good cholesterol, and the other is the bad cholesterol. The bad cholesterols include LDL, that is low density lipoproteins, and the very bad cholesterol is the VLDL, which is very low density lipoproteins. So basically, to understand more of cholesterol, we need to know that part of the cholesterol in our body is absorbed from our food and diet, whereas there is a significant amount of cholesterol synthesized in our body itself. So these are the two different sources of cholesterol in our body. And the third most important thing is the rate of metabolism and excretion of cholesterol in bile. If the rate of metabolism is high, the excretion of cholesterol in bile will also be more. And the fourth, or the last but not the least thing, is the reabsorption of cholesterol in the intestines through bile acids takes place in our body, which is also an important function which maintains the cholesterol level in our body. In dyslipidemia, there can be a variety of conditions like elevated LDL or bad cholesterol level, bad cholesterol, or there may be a lower level of HDL, which is the good cholesterol. So whether it is an increase in the bad cholesterol or a decrease in the good cholesterol, excess levels of triglycerides can also harm the cardiovascular system. Most people with dyslipidemia feel perfectly well and often have no symptoms. It is frequently discovered during a routine blood test. It is necessary to do a routine blood checkup, as high LDL and triglyceride levels put one individual at a higher risk for heart attack and stroke. Low levels of HDL cholesterol are linked to higher heart disease risk. Cholesterol can be a confusing health topic for a lot of people, but understanding and managing its levels is an important step in taking control of our heart health. For example, you can divide all the food we eat into two categories broadly. One is all the fresh food which are easily perishable are good for our health as well as for our heart. On the other hand, all the food which have a long shelf life, which are loaded with preservatives, are not good for our health nor for our heart. So we should limit foods high in saturated fats, and saturated fats come from animal products such as milk, curd, butter, ghee, cheese, or even fatty meats like red meat, and tropical oils such as palm oil. On the other hand, we should choose foods that are low in saturated fat or trans fat or sodium and added sugars. These food include lean meat or white meat, that is your chicken and fish or seafood. Fat free or low fat milk is not 100% safe because it still contains the cow's estrogen, which is not good for our health. Whole grains, fruits, and fresh vegetables are definitely beneficial for our good health. We should also eat foods which are naturally high in fiber, such as oatmeals, millets, beans, and other unsaturated fats, which can be found, for example, in a fruit called avocado, which contains fiber as well as good levels of, it's good to improve your lipid levels. Olive oil is also another very important oil which has recently become very popular. But the catch is we are not supposed to heat olive oil. When you heat olive oil, it becomes poison for the body. So we should consume olive oil without heating it. So these are the food which help prevent and manage high levels of bad cholesterol and triglycerides while increasing good cholesterol levels. Eat only enough calories to maintain a healthy weight. Foods such as fruits and vegetables, whole grains, nuts, and seeds can help lower the LDL. One more important line I would like to add here is about the cooking oil which we use in our day to day cooking. So I would recommend sunflower oil for to be used as cooking oil, which is found to be very beneficial for the cardiovascular system. So in addition to this, maintain a healthy weight, get regular exercise, quit smoking, take your medicine as directed by your doctor. Thank you.